Have you ever experienced the sensation of seeing or hearing something that wasn't really there? Or do you know someone who has? Whether it's a one-time experience or an everyday occurrence, hallucinations can be both fascinating and terrifying. Well, in today's video, we'll explore 7 must-know facts about hallucinations to increase your understanding of this phenomenon. So let's dive in. Fact number 1 to know is that hallucinations are sensory experiences that seem real, but are not, okay? The term hallucination was coined by the 17th century physician, Sir Thomas Browne. He used the term in his 1946 book, Pseudodoxia Epidemica, and derived it from the Latin word hallucinare, which means to wander the mind. The more modern definition in the DSM-5 states that hallucinations are perception-like experiences that occur without an external stimulus. What this means is that you can have an experience that seems very real, but there's nothing actually physically causing it. It's all happening in your mind. What's truly remarkable about hallucinations is that they can be incredibly vivid and clear, with the full force and impact of normal perceptions. And what can be scary is that hallucinations are not under the individual's control. They can be extremely unsettling and disorienting, and may even lead to dangerous behaviors if the person acts on the false sensory information. Fact number 2 is that hallucinations can involve any of the 5 senses. However, out of all of them, studies have shown that auditory hallucinations are the most common type experienced. This is when someone hears something that isn't really there, and this can range from hearing a voice talking to you to hearing noises like buzzing or ringing. Other sensory hallucinations can include visual hallucinations, where someone sees something that isn't really there, like a person or an object. Tactile hallucinations are when someone feels something that isn't there, like insects crawling on your skin. Gustatory hallucinations involve taste, where someone may taste something that isn't present, like a metallic or bitter taste. And then olfactory hallucinations involve smell, where someone may smell something that isn't there, like burning or odor. Fact number 3 is that for a doctor to determine whether a reported hallucination is meaningful, it's important for an individual to be able to distinguish between what is real and what is not. As we grow and learn, we start to understand the differences between what's happening in our own minds and what's actually happening in the world around us. It's like learning the difference between a dream and real life. Most children are able to make this distinction by the age of 3 years old. Now, another important thing to keep in mind when it comes to hallucinations is the possibility of an illusion being reported instead of an actual hallucination. Illusions are misrepresentations or misinterpretations of real external stimuli, which means that something in the environment is actually there, but it's being perceived or interpreted incorrectly. So for example, imagine seeing a hose in the yard and mistaking it for a snake. In this case, the object is real and present, but the way it's being perceived or interpreted is not accurate. It's important for doctors to be able to differentiate between illusions and hallucinations, as the causes and treatments can be quite different. The 4th fact to know about is that hallucinations occur on a continuum, meaning that there's a range of experiences from healthy individuals to those with more severe psychopathological syndromes. It's not just something that happens to people with serious mental illness. About 5 to 15% of the general population reports experiencing auditory hallucinations at some point in their lives. Interestingly, research has shown that 2/3 of children between the ages of 9 and 11 have had at least one psychotic-like experience, including hallucinations, okay? However, the vast majority of these experiences are transient, meaning that they last for a short amount of time and they usually resolve spontaneously. In fact, about approximately 50 to 95% of cases discontinue after a few weeks or months. It's crucial to understand that when someone hears voices, there are a lot of potential reasons for this. I frequently have patients tell me that they hear their own voice or the voice of someone they know. Many times, this voice represents their own internal thoughts or emotions. So for example, if someone is feeling very sad, okay, they might hear a voice telling them negative things about themselves. And then, for some people, voices can also be a coping mechanism during challenging situations. Fact number 5 is that there's differences between healthy voice hearers and clinical voice hearers. Research looked at 36 studies and several thousands of patients and found some interesting distinctions between the 2 groups, and there are 5 in particular that I want you to know about. Healthy voice hearers generally have voices that started at a younger age, okay, usually in late childhood. The voices occur less frequently and have a shorter duration. They're not usually overly distressing and can actually be positive or encouraging a lot of the time. And the person usually feels in control of the voices. And then on top of that, the person also doesn't have day-to-day impairments from the voices. Healthy voice hearers are also more likely to attribute their voice to an external source, often within a spiritual framework, like a guardian angel or something like that. In comparison, clinical voice hearers typically have a delayed age of onset, so usually around late teens or early adulthood. They hear voices that are more frequent and persistent. The content that they hear is usually negative and very distressing. The person feels like they don't have much control over the voices, and then sometimes they even feel like the voices control them, right? And then, as you can imagine, the voices can cause a lot of day-to-day impairment and interfere with everyday functioning. So something that I found interesting was that despite these differences, researchers did not find variation between the two groups in the number of voices heard, their loudness, or whether they were perceived as originating within or outside the head. Now, the sixth fact is that trauma can increase the risk of developing hallucinations. Studies have found a positive association between sexual abuse, physical abuse, emotional abuse, bullying, and neglect. The risk is increased 2 to 4 times that for those who have experienced sexual abuse in particular. It's worth noting that not everyone who has experienced these negative life events will develop hallucinations, and that not everyone with hallucinations has experienced negative life events. But it's important to keep in mind that discontinuing negative life events, such as maybe ending an abusive relationship, can predict the discontinuation of hallucinations. This presents an opportunity for targeted intervention strategies that address the root cause of the hallucinations, whether they stem from trauma or other factors. And this can potentially prevent or mitigate the onset of hallucinations for many people out there. Fact number 7 is that hallucinations from schizophrenia occur in just 1% of the population. Studies show that when looking at kids, which is important because, right, as we mentioned, hallucinations typically first start during one's childhood or late teens. What we see is that 70% occur due to mood disorders, 20% are secondary to trauma, and 4 to 5% may be drug-related. The rest are thought to be due to a primary thought disorder. And when it comes down to it, hallucinations can be caused by a variety of factors outside of mental illness. Sleep deprivation, substance use, neurological conditions, medication side effects, and physical illness can all cause hallucinations. When we're talking about sleep in particular, hypnagogic hallucinations are those that occur when falling asleep, and hypnopompic hallucinations are those that occur upon waking. These are reported in 25% and 18% of the general population, so a relatively common experience. Now, if you're interested in learning more about schizophrenia in particular, make sure to click that top video.